Good afternoon. Welcome to the fifth installment of our 2016 webinar series on the 8 dimensions of public health. My name is Kathleen Sobiak. I am a visiting academic specialist under the Office of the Dean with IU's School of Public Health, Bloomington. Since March, experts from our school have been presenting on the 8 dimensions of public health in an effort to broaden our view of public health. We hope by these series we are connecting with other academic institutions, local community partners, and you, the participants. Like today, each of the webinars is on the 4th Wednesday of the month from 12 until 12:45 from now until November. Before we get started, let's just go over a few of the logistics. If you have any questions during the lecture, please submit them through Adobe Connect. Closed captioning service is available through Adobe Connect as well. If you need continuing education units, please complete and submit the content quiz located on the Adobe Connect pod, and we will be in contact with you about receiving a 1-hour credit. Finally, please take a minute to complete the satisfaction survey at the end of the webinar. And now I'd like to introduce to you our faculty presenter. Dr. Deb Getz is an assistant clinical professor with our Department of Applied Health Science. She is passionate about her teaching and promoting safe and engaging programs for youth and families. Her special areas of interest include financial health as well as human trafficking. Joining her for a brief discussion will be Ms. Kathy Hewitt from the Monroe County Health Department. Ms. Hewitt is the lead health educator, and in this role, she sits on many diverse stakeholder boards, and she works with the community members on various topics, including nutrition, wellness, and financial health. Today, they want you to be empowered to act regarding your personal and professional financial wellness. They will start with an overview of some models to frame the conversation on financial health and end with action items for you to take. Again, if you have questions during the lecture, please use the Adobe Connect pod to submit them, and we will have a discussion with Dr. Getz after the lecture. And now, let's start the video.
I'm Deb Getz, and together we're going to be talking about how you can be empowered to act specifically in regard to your personal and professional financial wellness. Ms. Kathy Hewitt from the Monroe County Public Health Department will join me later, and together we will be able to help you think about and define financial health, explain how different theoretical models can be used to reflect on financial health. You'll be able to outline the role of financial health in your life, and you'll be able to identify action steps for moving forward. When we're thinking about financial wellness, it's important to think about how financial wellness is one part of the 8 dimensions of wellness that support your overall life. And as with the other dimensions, it's important to understand that when one is out of balance or in balance, it impacts every aspect of your life. When we define financial health, we're talking about the relationship between an individual or group and their money and credit. There's numerous studies about the evidence of stress on individuals. You see some results from some of those studies here on the screen. The key thing to understand is that when we're thinking about stress or emotional health, we still need to make sure we're thinking about financial health when it works into the overall dimensions of wellness. One way in which we can have positive impacts on individuals' financial wellness is to look at ways in which workplaces can provide education about finances. We need to understand that many of us haven't had a lot of education specific to financial issues. And so allowing workplaces to provide that education can be very positive. For individuals who were involved in this study by Garmin that took part in financial education experiences, they identified that their financial well-being did improve. They reported better financial wellness, and they indicated that they wanted more educational sessions. 80% felt the need to ask for more educational sessions. For those who chose not to participate, they were worried about their monthly living expenses, the money they owed, and they were more likely to cut down on their living expenses and to have reached the maximum limit on their credit cards. When we stop and think about the status of your organizational or personal financial situation, at the personal level, the most expensive thing that we have in our financial world is housing. If you have a loan for your housing, then that's something you need to think about as credit or loans. And if you have started purchasing or have purchased your home, that's an identification of something that's an asset. You can see some of the other areas where your personal financial situation is impacted, and it's important to keep each of these in mind for your own personal financial situation, but also for those with whom you work. As we look at financial health, it's really nice to be able to use some models. So we'll be going through a few models today as we move forward in our conversation. I'm very fond of Maslow's Hierarchy of Needs. Back in 1943, he published this concept that is very useful in understanding a variety of topics. When it comes to financial health, it's really important to stop and realize that each one of the 5 layers that are a part of Maslow really can give us some insight and help us understand how we can take and reflect on financial health in our own world, but also in the world of the folks with whom we work. The first and the base level within Maslow is physiological, and this talks specifically about the ways in which your basic housing can be important to your life. If you don't have food and housing, it's hard to really move forward up the triangle towards the top and the ultimate goal of self-actualization. Some more data specific to the physiological aspect of Maslow comes from looking at a recent Indiana Youth Institute study that indicated that folks who came to food banks within the state of Indiana were prioritizing things like rent, utilities, transportation, over things like food and medicine. And so when folks are being required to stop and make choices about whether or not they should have a place to live or if they should be eating or paying for their medicine, it's a tough call, but those seem to be the things that are common among the folks who are accessing Indiana food banks. Another component of the physiological access that is important within Maslow is looking at how much money folks are spending on housing. Generally, we identify that those who are paying more than 30% of their overall income to support their housing situation are identified as having a housing burden. So what we really like to see for housing of amounts over the entire budget available to individuals is that we keep that number at or about 25%. Beyond that, it becomes more of a burden, and it really has a negative impact on how folks can meet their physiological needs. Additionally, safety is something to look at. And if folks are comfortable with their physiological needs, again, those things that are basic housing and food, then they can start looking at meeting their safety needs. One way in which we can define safety is simply knowing that you are out of danger. And if you feel like you're out of danger, then you can actually meet those safety needs and start, again, working up the pyramid. Those who are under financial danger or threat can be overwhelmingly stressed. And this is difficult because if somebody's constantly worried about being evicted or losing their home or having to go into foreclosure, then that's what they're really focusing on. They're not able to really look towards the relationships that come next. We have to make sure that we also, again, think back to that bigger picture of the dimensions of wellness and realize that if folks don't feel like they have a good house over their head, they don't have their food needs met, then they're not able to move to safety, and that safety piece is allowing us to stop and think about how they are in or out of danger. And one of the things, an example for this one is simply if someone lives in a neighborhood that has a high crime rate. If you have a high crime rate, then you're not going to be able to focus on your relationships. You're really going to be concerned more about how you can be safe and how you can keep your family safe. When we move up to the third level, this is where we've had the opportunity to have good, safe housing and have our food needs met. You're also feeling that you have a strong, safe environment in which you can live. And as a result of those two things, you can actually get to the point where you feel as though you're able to start building relationships, showing that love on a consistent basis, and also understanding that you can feel like you have belonging and create the relationships that support both love and belonging in your life. This also includes the opportunity to have your family around you or to create folks who build that family relationship with you. When we talk about financial health and happiness, it's important to realize that all of these layers are impacted by your ability to feel financially well. When we look at esteem, things like achievement and confidence are crucial in building your own esteem. And what's really interesting is that you also have the opportunity to respect other people because you're not so inwardly focused on yourself, and it gives you an opportunity to gain the respect of others. If you think about the financial impact of feeling safe and secure, knowing that you don't have to worry about your housing situation, and knowing that you've had the opportunity to build positive relationships, then your esteem can grow and you can have a better opportunity to understand who you are and how you can work around other folks. Not having financial stability means that you would never get to the esteem portion because you're constantly being focused on those outward situations and the stress that comes with not being able to afford the basic components of life. Even those who have really strong financial status, if they're not managing their money well, or if they don't feel confident about their money, they may still have a difficult time reaching the esteem level of Maslow. And then ultimately, this is where we're looking for the opportunity to really reach self-actualization. You've been able to meet all of the levels below. You've got comfort in those things. You're doing problem solving and practicing for each one of those levels. And now you're really getting to the point where you can look at the big picture. You can see the big picture around you. You're going to have a better opportunity to accept the things that are in your life. You're going to be able to be a lot more creative. You're going to be able to have that time it takes that you're not using to focus on your own financial status and potential, and you're going to be able to take that into a place where you're going to really be able to balance all of the aspects of wellness in your life. When we reach self-actualization, it doesn't mean we don't have to manage our money or that we are millionaires. It simply means that we've accepted all of the other pieces, they're all in good status, and our world is in a positive way. Now, sometimes things happen that bring us from the point of self-actualization all the way down a couple steps. If you have a major physical illness, that's going to have an impact on your overall financial health as well, and it could potentially bring you from that point of self-actualization all the way down to the place where you have to stop and reevaluate. Just because you reach self-actualization with regard to your financial health or any other aspect of your health doesn't mean you're going to stay there. It just means that that's your opportunity to take everything in and realize that even if there's challenges that bring you down, hopefully that's when your resilience can kick in and you can get back to that point of self-actualization again, and maybe a lot faster. Now we're going to take the opportunity to bring in Miss Kathy Hewitt. Kathy is a lead health educator in the Monroe County Health Department, and she's been willing to come in and talk with us about some of the things that are going on within her place of employment and how she works with others regarding financial health.
Thank you, Deb. It's a pleasure to be here.
Can you tell me some of the concerns that you have when you work with folks at the Monroe County Health Department?
Sure. Financial health really does impact all the other dimensions of health. For example, limited finances can limit the resources that people can access to improve their quality of health. For example, for emotional health, when you have limited financial resources, that can make people have a tremendous amount of stress and anxiety about how to handle their life and how to get all the needs they have for themselves and their family. For intellectual, it can impact the level of higher education or training that they get, and that can further impact what type of job they can get later. For environmental, when you have limited financial resources, it can affect the neighborhood that you end up living in, which can impact the social norms that you learn, that what you consider healthy. It can impact whether you have a safe and healthy place to be outside or for your children to go play. And it can also impact whether you have access to healthy food or if you have a safe, if it's a safe environment where you actually do want to be outside.
Wow, that's a lot of specific ideas that you shared with us, and it's difficult to try and support them. So how do you support their financial health?
Well, we support financial health as one of the 8 dimensions of health. We try to incorporate that into other trainings we do. We try to think about that when we do health programming. We think about the financial aspect of whether people can afford to do it, whether they can work it into their lives, or we try to think of lower cost choices that they can do instead.
And as we look at understanding and supporting financial health, how do you empower people to really act about their financial situation?
Well, one way we do that is in our training. We have people who come in who actually give them active roles and active action plans so that they can make choices, so they can see where they are right now and see where they want to go and can create the steps that they need to get there.
Excellent. We're going to talk a little bit more about that in this session. So that's nice that you've been able to say that's something you work together with the clients that you work with. What are the biggest challenges you have when you assist folks within Monroe County?
Some of the biggest challenges we have is many people are, to borrow Maslow's terms, many people are down more toward the bottom and more focused on the basic needs that they have, and that's understandable. Those are the things that are occupying their mind, and that's what they need to get. So they don't always consider some of the other aspects of health as important, or they can't pay attention to those other aspects of health because they are spending all their energy just trying to provide those basic needs.
And that comes a lot when folks have multiple jobs and they
Exactly.
then feel like they're stressed about the jobs, then they don't have enough sleep, and then their health breaks down. So it's nice to hear that you guys are focusing on that. I know you guys recently participated in a think tank. Can you identify some of the things that folks within this meeting had with regard to community health improvement plans?
Sure. That was part of the health department, IU Health Bloomington, IU School of Public Health, and Achieve was working on a community health assessment within the last year. We recently presented that to the community at our think tank, where we invited all the participants to hear the survey data from the community health assessment as well as data about our county, so that they could assess, all of us could assess together and determine what were the things that we wanted to work on in the next 3 years as a community health improvement plan. Both the survey and the data identified 3 top issues The first being substance abuse, mental health, the second being chronic disease/obesity, and the third were basic needs.
Wow, and all three of those are very much impacted by financial health or impact financial health.
All three of them are, yes.
Very central. I really appreciate you coming and sharing from the practitioner's perspective what you're seeing on the ground level, and I think it helps us understand what we need to be looking for, both using the Maslow's hierarchy, but I think it also introduces us to a couple other structures that'll help us understand how we can constantly be looking out to help folks with their own financial health. Thanks.
Thank you, Deb.
Another tool to use when you're looking at your own financial health is the social ecological model. This model helps you look at your life in a variety of different levels and helps give you a self-check that you can consider as you're looking at, again, both your own life, but the life of the folks with whom you work. Just like Kathy said, it's not just about them, an individual themselves, it's also other things that impact them. If we're looking at the individual model, we're really looking at just who we are as an individual and how our individual world is impacted by our own financial health. When we look at the relationships, that includes family and friends. And it's important to understand who's there for support or who's there that needs supported. And that's really important when we're really looking at that smallest level that allows us to really stop and say, how are financial things in my world impacting me, but also those folks who are right next to me? When we think about the community level, we think about school, work, church, those kinds of things. And when we stop and think about how our finances impact our abilities or who are impacted by us at the individual and relationship level, it also gives us this opportunity to say, how do finances impact my life in different ways? When we get beyond the community level, we're looking at society, and that's where laws and regulations come in. Is there a new law that impacts my ability to make money? Right now, one of the big laws being considered in multiple states is that of increasing the minimum wage. If we think about a minimum wage increase, that definitely will impact a lot of individuals, but it also impacts how those individuals relate across their family life, but also into the community. And so we have to remember to think about all of these areas together. Some examples about job loss and unemployment. When we have these things that occur in our lives, both our psychological and physical well-being are reduced. And it results for a lot of folks in social withdrawal and family disruption. And while this sounds very common sense, we have to remember to think about these things in an intentional way. As Kathy said, those are things that they're really looking for when they're working with folks on an individual level or in small groups to help them really think about who they are and how they can be making positive improvements in their life. Again, some of the things to think about is what's the impact on the children. Sometimes that results in lower levels of attainment, but also in lower well-being. That comes as a result of impact on school, the amount of time kids get help from parents, and the overall well-being that they have in their lives. One really specific study indicated that depression and anxiety among displaced workers is about 30%. When we look at workers who are not displaced and fully employed, it's about 15%. So you can see that's a pretty significant impact. One more model is one that is a great opportunity to look at how the things in an individual's environment really impact who they are. We refer to this as the social determinants of health. And you can see that the economic stability is one of the things to be considered when we think about the places where people live, learn, play, and work, and how those things can be impacted within an individual's life. Economic stability, built environment, health and healthcare, social and community context, and education. And it's very interesting to be able to step back and do a self-check, again, for you as an individual or for the people with whom you work. How are these things being impacted by their financial status? One of the other things to keep in mind as you're looking towards financial health is being able to stop and reflect on how those pieces come together to support success. A lot of the time we've talked together has been focused on low socioeconomic status. We also have those folks who are making a lot of money and able to live comfortably, but they might also have negative impacts based upon any one of these 5 areas. When we look at our financial health across the lifespan, there's some real specific things that happen and that impact that financial health. Among babies and toddlers, healthcare is really important. We know that before babies are born, if mom has strong healthcare, they're going to be healthier. We also know that's important to maintain over time. We also know how important it is to have safe food and water. May be thinking about some of the things that are happening in Michigan with regard to the safety of water. Those are important basic things for kids to have as young babies and toddlers. Social stimulation might also be impacted if babies and toddlers are away from the home a lot, if they're not able to be around their parents. When we think about children, a lot of the focus there, most kids are going to be generally healthy, so a lot of the things that are happening across their financial health is going to be tied to their education and the social economic status of the facilities in which they attend. With adolescents, they're really focusing on higher education and unemployment or employment. The employment rate for adolescents is one that's been pretty tough for the last couple of years, and it makes it tough for kids that are trying to support themselves a little bit so their families don't need to have that entire burden. Among early adults, they're really starting to think about families and getting an entry into the job world. So that's where their focus is. By the time folks get into that middle adulthood stage, it's really about having families. A lot of folks are going to have identified chronic health issues that are going to start during that middle adulthood time period, and they're also going to be needing to prepare for retirement as they get into the job world. And then as we move into the end, towards the end with older adults, there's going to continue to think about increased health issues and issues that are related to retirement. We're going to move forward and I want to give you a little quiz. I want you just to put a check for each one of these 8 items that show here on the screen. And as you're doing this, think about your current status with these items. For each one that you can say yes, just give yourself a check, and then I want you to count up the total number of checks, and then that will set you up to be able to grade according to the following scale. If you had 7 to 8 points, that means you're doing pretty well, and you can just keep moving forward at the pace that you've set for yourself. If you're at that 5 or 6 range, there's some opportunities for you to improve, but you're well on your way. And then if you're down in the 3 or 4 point range, then it's time for you to ask for some help and not be afraid to ask for help. None of us were born knowing how to manage our financial status or financial process, and very few of us are actually taught. One of the best ways to move forward with making some positive improvements in your financial life, but in any aspect of your life, is to set some SMART goals. A good SMART goal is specific, measurable, achievable, realistic, and timely. And I have 2 examples there at the bottom for you that provide that opportunity for you to see a good SMART goal. For the first one, a lot of times we don't even know where to start when it comes to financial management. So if you could just come up with a list of questions, have it 3 or 4, and then get those answers by a specific date. And that allows you to put together a SMART goal that helps you move forward and make progress. Another one is identified to allow you to stop and think specifically about a particular topic. In this case, I provide the example of health insurance. As we move forward, it's nice to have a checklist. It's really important to have a financial health buddy. Many of us utilize our spouses or significant others, but if they're not on board, it doesn't mean that you don't need to do it. It just means you're going to have to look a little harder to find somebody who can do this with you. It's a lot easier if you have somebody that you can talk to about a particular issue. The other thing is to start a budget or a tracker to identify how much money is coming in, how much money is going out, and don't feel like you have to accomplish everything right away. Start with easy goals that you can accomplish and then allow those to get a little bit broader and bigger as you move forward over time. Make sure that you're reviewing your money and money in and out weekly and then ultimately monthly, and identify what you want to change. If you know where you're going, you know how much you're spending, it makes it a lot easier. And as I said before, if you stop and think about the fact that very few of us were ever given any education about these topics, but they impact us very significantly in our lives, then you need to understand that you should never feel guilty about what questions you're asking. It's your job to keep asking those questions until you get them answered. So for our action items, we want you to acknowledge that this is a difficult topic. It's difficult for everybody. Everybody had to start sometime. Remember to utilize both Maslow, the socio-ecological model, and those social determinants of health in order to guide you for your personal financial management, but also to help others. Treat your finances like your planner or calendar. Many of us have to have really intense calendars because we have both personal and professional lives that we manage. Think about managing your finances in the same way. Look at them daily, know what's happening, start to anticipate things that are coming in the future. Regularly reflect on and identify what about your financial health causes you stress. If you know what's causing you stress, then those are the ones you want to start with first. Think about the ones that give you the most stress from the beginning. Definitely create those SMART goals, find that financial health buddy, and put a plan in writing. We know that if you have a plan in writing versus something in your head, you're going to be a lot more likely to accomplish it.